One of the things that people get hung up on the most when signing up for Medicare is whether they should pick Original Medicare or Medicare Advantage. There are a lot of aspects to consider, but don't worry, I'm here to help. Hi, I'm Tricia Sandiego. In my work with AARP, I help people understand the ins and outs of Medicare. Let's take a look at the differences between Original Medicare and Medicare Advantage. To start, it's important to note that both options offer basic healthcare coverage. That's your hospital stays, doctor visits, and diagnostic tests. But there are differences, especially when it comes to access to providers, costs, and how each plan is run. Here's the easiest way to think about it. Original Medicare is run by the federal government. Medicare Advantage is a private health insurance alternative, but companies must be approved by the government and follow strict rules. Now, let's talk a little bit about differences when it comes to access to providers. Original Medicare lets you see any doctor or healthcare provider who takes the program. You won't need a referral to see a specialist. I'll talk more about that in a minute. Medicare Advantage plans work like insurance you may have through your employer. In most cases, you'll have a primary care provider who must be in-network, depending on which plan you go with. Your plan may also require you to get a referral from your primary care provider before seeing a specialist. If you see a provider outside of the plan's network, you may wind up paying more for your coverage. It's also possible that your plan may not pay at all, so make sure you know if that's a possibility before you get too far down the road with a given provider. And there's more. With Original Medicare, you can see any doctor anywhere in the country who takes Medicare. Medicare Advantage plans typically operate in specific geographic areas. If you travel a lot or live part of the year in another part of the country, your coverage may not extend outside of your plan's local area, with the exception of emergency care. So check your plan's rules to be sure you're prepared and covered. Okay, so how do you know what's covered and what's not under each option? Let's look at some specifics. Both Original Medicare and Medicare Advantage plans cover the same basic healthcare services to meet your medical needs, but costs can be different. Original Medicare does not cover some needs, like routine vision, dental, and hearing care. Medicare Advantage plans, however, may at least partially include them. You can buy a separate private insurance plan for these services if needed. One very big thing to consider is your coverage for prescription drugs, which is really important to have, especially as you get older. If you choose Original Medicare, prescription drugs are not included. You'll need to enroll in a separate plan under a part of Medicare called Medicare Part D. If you go with Medicare Advantage, most plans already include Part D prescription drug coverage. Okay, let's look at cost scenarios. It's important to know that Original Medicare requires cost sharing for many services and does not limit how much you may have to pay for these costs. This unpredictability is why most people with Original Medicare also have supplemental coverage. For example, a Medigap policy you purchase on your own, a retiree plan offered by a former employer, or Medicaid for people who qualify. In general, each Medicare Advantage plan determines in advance how much you pay when you use a covered service. All plans have an annual limit for how much you pay in total, which makes it easier to anticipate costs. And here's one last thing to keep in mind if travel is a part of your lifestyle. Neither Original Medicare nor Medicare Advantage will cover your health care when you leave the country. Some Medigap plans, like the ones I mentioned earlier, offer some foreign travel emergency coverage, as do some Medicare Advantage plans. So you'll definitely want to look into this to be sure you're covered before you take your next trip abroad. For more helpful information, visit aarp.org/Medicare. Please take a moment to subscribe to our YouTube channel so you don't miss out on future videos like this from AARP.